Okay, name and title, please.
Hi, I'm Craig C. I'm a general surgeon in the Baptist system and the chief of surgery for both North Central Baptist and Baptist Health System.
Okay.
So Northeast Baptist, being a center of excellence, has been very positive for our robotics program. What a center of excellence does is, number one, it gives a presence and awareness to both the physicians who are part of it, the staff, but also importantly the administration. It helps us get support in both the equipment that we need. It helps us make sure that we're staying current with the technology. It has really put some energy into our volume. It attracts other robotic surgeons to the program, and I think in robotics especially there's a lot of moving parts, so it's not just how well your surgeon does robotics, it's how well they can be supported by the staff, how familiar with the equipment people are. So that's one of the biggest things that I noticed when we made our transition to a center of excellence. So robotic surgery is a form of minimally invasive surgery. When I was a resident, I did my residency long enough where we really didn't have robotics. It wasn't mainstream, but I am young enough where we were doing laparoscopic surgery. So laparoscopic surgery was pretty common. We knew right away that minimally invasive surgery is like it sounds. It's less invasive. It has less of a physiologic impact on a patient, so they typically recover quicker. There's usually less pain, and frankly, it's sometimes the operation's actually easier to do that way. When robotics came into more mainstream awareness and availability, I was part of a group of surgeons who were trained after our residency on the robot. I love it. I think both the technology has improved visualization. It's like the difference between driving a car with power steering versus rack and pinion steering. So the robot's not doing surgery for you. The robot's a tool that the surgeon uses, and I'm always for using the best tool that I have. Patients recover quicker for me. They seem to have less pain. Again, these are things we try to measure. They go home sooner, they return to work sooner. So to me, those are all positive things from robotics. So the types of surgery I do, well, first of all, as I mentioned, I'm a general surgeon, and I kind of, among my friends, I have a little joke that I say it's kind of an unfortunate name because people think, oh, you kind of do every surgery. Well, that's not really what general surgery does. General surgeons typically were focused mostly on the abdominal cavity. We do some head and neck surgery and other areas of the bodies that may have tumors, cancers, etc. So what robotics has done for mostly our surgeries that happen in the body cavities, it's given us a minimally invasive way to treat those. One of the things that I do commonly is I fix hernias. They're holes that are in an area that either should not have a hole or perhaps the hole got larger. So I do inguinal hernia repairs, ventral hernia repairs, which is the abdominal wall. I even repair hernias in the diaphragm, which is called a paraesophageal hernia. Sometimes those can be quite large, and the robots really, to me, revolutionized the way to do it. I also do operations where we remove organs like the gallbladder, and I typically do single site surgeries for the gallbladder. So I use one incision right at the belly button and can do the entire procedure through that. That's a surgery that's possible laparoscopically, but it was very difficult. Robotics has made it, frankly, routine for me. I also remove the colon, parts of the colon, for diseases like diverticulitis or colon cancer. I do that with the robot as well. As a general surgeon, I'm also asked to help some of the other subspecialties. So I've been parts of robotic kidney operations, so a nephrectomy, and I've also helped the gynecologist do procedures. In fact, sometimes I'll do combined procedures with them. So say a woman needs a hysterectomy, which they can do robotically, and may have a hernia as well. I'll have the gynecologist get in, they'll do a hysterectomy, and then I'll follow up and take over the robot and fix the hernia on the way out. So a lot of versatility, and each year we're expanding the things that we can and want to do with the robot.